Welcome everyone, my name is Steve Misek and I'm the host of our live events at Rush University Medical Center. Today our guest is Dr. Parik Sharma, the Section Chief of Electrophysiology at Rush and an Associate Professor at Rush Medical College. Thank you so much for joining us today.
Thank you, Stephen. Thanks for having me.
Absolutely. To get things started, tell us a little bit about your roles here at Rush.
So I'm a cardiac electrophysiologist. In simple terms, I'm a heart rhythm specialist, or in more lay terms, I'm the electrician of the heart. So we are physicians or cardiologists that specialize in rhythm management. So patients that deal with very slow heart rhythms or fast abnormal rhythms of the heart, patients that need pacemakers, defibrillators, or patients that need procedures such as ablation procedures to fix some of these abnormal rhythms.
Gotcha. And you also are a professor as well. And what do you teach?
So I'm an associate professor, so we are responsible for the education for cardiology fellows or trainees, residents. We have fellows under us that are already cardiologists that are wanting to become specialists in this space, and so they're called electrophysiology fellows. So we're responsible for the education for a lot of those trainees.
Gotcha. And so September is Atrial Fibrillation Awareness Month, and that's when we want to bring more attention to this health problem that affects millions of Americans every year. Can you briefly describe what atrial fibrillation, or AFib, is and some of the symptoms, maybe?
Yeah, so like you highlighted, I think atrial fibrillation is one of the most common rhythm disturbances that affects Americans. Close to about 4 to 5 million Americans suffer from atrial fibrillation at the present time based on reported data. And projections are that by the year 2030, over 12 million Americans will be suffering from this rhythm disorder. So atrial fibrillation, as the term implies, the top chambers of the heart are called the atria. So when these top chambers of the heart go into an abnormal, chaotic, disorganized rhythm, or fibrillation, it's referred to as atrial fibrillation or AFib. And this is a condition in which typically the top chambers of the heart are beating at about 60 to 100 beats per minute, and that's what drives our heart rate. When the cells in the top chambers of the heart get abnormally irritable and get disorganized in their activity, they go into put these chambers into atrial fibrillation, and then these chambers are beating on an average rate about 500 to 600 beats per minute.
Oh gosh.
As opposed to 60 to 100 beats per minute. So that's the abnormal rhythm, and this rapid beating of the top chambers then tries to drive the beating of the bottom chambers, which are the main pumping chambers of the heart. And that's why patients can have heart rates that can be extremely fast, 150, 160, 180 beats per minute, depending on how quickly these electrical impulses can make it from the top to the bottom chambers.
And how does it affect the body when you're experiencing atrial fibrillation?
So as you can imagine, the abnormal beating of the top chambers of the heart does make the functioning of the heart quite inefficient. Typically, with each heartbeat, the top chambers squeeze and pump blood from the top to the bottom chambers. When the top chambers are beating at about 500 to 600 beats per minute in atrial fibrillation, they're essentially not doing that pumping function and squeezing blood to the bottom chambers. That makes the functioning of the heart relatively inefficient, and that then produces a variety of symptoms. If the patient has a very rapid heart rate, they can experience palpitations. Most patients, particularly older individuals, tend to experience fatigue. They feel like their days they don't have as much energy and cannot do as much. Lack of the ability to exercise or exert yourself, or exercise intolerance as we call it. And some patients might experience dyspnea or shortness of breath with exertion as well. So the lack of the efficient functioning of the heart itself translates into a lot of these symptoms.
Right, that makes sense. Well, how does someone develop AFib? Because that seems like something, it seems sort of random, but I imagine there's probably something that leads up to that as well.
Yeah, so it is very well known. In the past, we used to consider atrial fibrillation as the disease of the aging heart, or the disease of the elderly, and we try to shy away from using that term elderly because it's all relative. But it used to be considered the disease of the aging heart. This is a disease process that occurs given the stress and strain the heart goes through over a number of years. And so as the heart gets older, it starts getting stiffer as well. And as that happens, as it stiffens up, the stress and strain on the top chambers continues to worsen with time, and that increases the irritability of some of these cells that then degenerate into atrial fibrillation.
I see.
But it's not just the age. Age is a risk factor that's non-modifiable, which means
Right.
we can't change it, right? What we can change are other risk factors, and these include high blood pressure or hypertension, patients that have high blood sugars or diabetes. So better control of these conditions can help decrease some of that stress and strain. Other conditions such as obesity, that causes stress and strain on the heart. There is another condition that is highly underappreciated, and that is referred to as obstructive sleep apnea. And so we ensure that all of our patients that have atrial fibrillation get evaluated with a sleep study for that. And then other risk factors in general, which are not heart healthy, which are smoking, alcoholism. These are all the risk factors that eventually increase the stress and strain in the heart and can lead to the development of atrial fibrillation at a much younger age than what is considered traditional.
Right. And so how is AFib distinct from other arrhythmias? Because I know that it's just one of several types.
Yeah, there are multiple rhythm disturbances we deal with regards to the heart, and they can be slow rhythms or bradyarrhythmias as we refer to them, and those are the ones that patients end up needing pacemakers for. They could be very rapid rhythms, especially if they're coming from the bottom chambers of the heart. Those can be life-threatening or can lead to a cardiac arrest, and patients need defibrillators for those. Atrial fibrillation, on the other hand, is a disease process as opposed to a simple rhythm disturbance, because it represents the stress and strain the heart has been through over the years.
Right.
And it can lead to many other comorbidities, such as an increased risk of stroke. Atrial fibrillation has been associated by at least about a 4 to 5-fold increased risk of stroke as compared to the general population that does not have atrial fibrillation. It can also lead to heart failure, which is weakening of the heart muscle. And certainly, as we discuss the symptoms that are associated with it, these are not typical for most other rhythms that we see with the heart.
Right. And so we talked about some of the risk factors for AFib, but are there some people who are more at risk just because of, their race or their sex or other genetic factors?
Well, there are certain genetic predispositions to atrial fibrillation, although they are rare. The bigger things that we usually go looking for are the risk factors that we discussed. There is also some data that suggests that female gender or women might be at a slightly higher risk for developing a stroke if they were to have atrial fibrillation as compared to their male counterparts.
I see. Now, people who have AFib, I wonder, we talk a lot about comorbidities, especially around COVID. Are people who have AFib, are they more at risk for COVID or more at risk for it being more damaging if they were to get it?
Yeah, I think the contrary might be true. So a lot of patients that develop COVID infections, because of the inflammatory state, can actually develop atrial fibrillation or go into atrial fibrillation even if they don't have a history of this abnormal disease process. And the reason for that is because COVID results in a extreme inflammatory surge throughout the body, and the heart is also part of that inflammatory reaction. So published literature has suggested anywhere between 15 to 40% incidence of developing atrial fibrillation amongst patients that develop a more extreme form of the COVID infection, and average being about 20%. So that's more common. On the flip side, patients that have a history of atrial fibrillation, like I said, atrial fibrillation represents the stress and strain on the heart. So yes, they are probably more likely to struggle a little bit if they were to develop a severe form of the COVID infection. But there's not a lot of data to suggest that they have a higher mortality rate or death rate.
I see. It's very interesting, though, that people are developing AFib as a result of COVID, because I feel like that's one of the things that we're not hearing about. There's obviously lots to talk about COVID, but that part doesn't come up so much.
Sure.
What are some of the ways that AFib is treated?
So I think the driver for the treatment of atrial fibrillation really depends on multiple factors. Is the patient symptomatic? Are they experiencing any of the symptoms we talked about?
Right.
And there's a subset of patients that don't really feel atrial fibrillation at all, which is what makes it really tricky to diagnose and treat. But in terms of what we do for management, I think the first thing is to protect these individuals from the risk of developing a stroke. And so a blood thinner is oftentimes part of the medical regimen to manage this disease condition. And subsequent to that, we have to do things to try and get them back to a normal rhythm, which is a normal heart rhythm. And that can be accomplished through medications referred to as antiarrhythmic drugs, or through minimally invasive procedures such as catheter-based ablation procedures or even surgical ablation procedures. And that gets more involved as time goes on. But there may be one therapy that suits one patient better than the other. And so it's a conversation back and forth between the electrophysiologist and the participating cardiologist with the patient to figure out what is the best treatment strategy for a given patient.
Right. So what you said just now about how sometimes people don't even realize they have AFib, that seems like it'd be quite dangerous. But what screenings are available to detect something like this that kind of goes a little under the radar?
Yeah, so that's the challenge. One of the big things is that oftentimes the first presenting symptom of atrial fibrillation is a stroke.
Oh gosh.
And so we do see patients from time to time in the hospital that come in with a stroke, and then we find out that they have atrial fibrillation. It's just that they never felt the symptoms. And so, I think there is no recommended screening tool, although, when patients go in to see their primary care physician or their family doctors, by them listening to their heart, checking the heart rate, the pulse, all of these are markers that will tell us whether things are normal or in the normal range or something off, and does the patient need an ECG, which would be the best way to diagnose atrial fibrillation. The other thing that is also becoming really popular, and I think a lot of the people that are tech savvy are leaning towards it, are wearable technologies. So,
right.
For example, the Apple Watch, and there are many others. The Samsung has its own watch, and then there are other devices. But these devices are smart enough to be able to pick up abnormalities in a rhythm and suggest that there may be a possibility a patient has atrial fibrillation, which you can then bring to the attention of your physician and appropriately diagnose it early.
Yeah,
So more options.
I was just going to ask if technology is aided in this in a consumer way, and it sounds like some of the devices have gotten smart enough to do so.
Yeah, there are pros and cons to all of these, but certainly I think that it is a step in the right direction and will require further sophistication as time goes on.
Certainly. So we've talked about this a little bit, but generally speaking, what happens if AFib goes untreated? Obviously, you said that stroke can lead you to realizing you even have AFib, but what happens if this just goes untreated?
Yeah, so I think most individuals that don't recognize they have atrial fibrillation, first off, don't get protected with a blood thinner. And so that puts them at a higher risk of stroke, and that risk increases with increasing age as well. The other issue is if the heart rate with atrial fibrillation is really rapid for long periods of time, it can start making the heart muscle weak, and they can develop signs and symptoms of heart failure, which is their lungs start filling up with fluid, their legs start swelling up. Those are all consequences of long durations of uncontrolled atrial fibrillation, and that is another way patients present in atrial fibrillation for the first time. So it does lead to an increased morbidity, which is poor quality of life overall. And there may be some very preliminary data that suggests that there could be an associated increased risk of mortality if this remains uncontrolled for a long period of time.
I see. But on the converse, if AFib is detected early, can it be more effectively treated?
Absolutely. There's a term we use in the medical literature that says atrial fibrillation begets atrial fibrillation. The more atrial fibrillation you have, the more it is poorly controlled, the more likely it is going to be more difficult to manage. And I use the analogy of high blood pressure or diabetes a lot with my patients, right? So patients understand that. If you come into your physician with a blood sugar of 150, it might be easier to manage that than if you go into your family doctor with a blood sugar of 500. right? So the same concept applies to atrial fibrillation. The longer it is uncontrolled or poorly controlled, the more difficult it becomes in the sense that you have to apply many more medical or procedural therapies to get it under control and prevent the disease process from continuing to get worse with time.
Is there anything that people can do themselves to help themselves prevent AFib or things like it?
Yeah, I think like we talked about a lot of the risk factors, right? I think it's very important to recognize that obesity is a big risk factor for atrial fibrillation. So ensuring diet and exercise, which is important for heart health in general, and the same applies to atrial fibrillation. Minimizing or moderating intake of things like alcohol. In fact, there is a lot of data that has emerged that any alcohol may be bad for patients that have atrial fibrillation, but I do ensure that we limit the amount of alcohol intake. Smoking. So all of these are the risk factors that patients, that we talked about earlier, that patients should recognize and start working on, that can decrease the rate at which the disease progresses and can keep it better controlled for a longer period of time, and maybe even prevent them from developing it early on in the course of their life.
So as we approach the end of our session, I wonder, is there anything else that you would really like our viewers at home to know about atrial fibrillation that we haven't covered here? Any other like facts that are, might be spurring people on to take more care about their health and look more into this with their doctors?
Yeah, I think it's important to realize that, there are various rhythm disorders that can cause symptoms. The biggest challenge with this particular rhythm disorder is that it can be asymptomatic. So it's important to get to see your physicians, your cardiologist on a regular basis so they can diagnose this condition in a timely fashion and prevent complications associated with it. And the other piece that I really want to drive home is that, like we always say, prevention is better than cure. So realizing some of the risk factors associated with this disease process, which are also overlapping with general heart health prevention, are really important. And so paying more attention to a lot of those would help you decrease the likelihood of developing some of these abnormal rhythms.
Well, we have to wrap it up, but thank you, Dr. Sharma, so much for taking the time to chat with us today, and thanks to everyone out there for watching and participating. Please visit rush.edu for more information about our cardiology program and all our great live events that are coming up. Thanks again.
Thanks, Stephen. Thank you guys for watching.